So now let's look at our vessels. So we look here, and we've got the aortic arch and the descending aorta. Coming off of that, we have a vessel here that is rather thick. This is the Brachiocephalic Trunk. It's going to have 3 branches here. We have the left common carotid, the right common carotid, and then down here is going to be the right subclavian. Okay? In the large animal, both subclavia come off the brachiocephalic trunk. But in the dog decided to be unique, and so therefore the left subclavia comes off all by itself. Now these branches that we cover on the left subclavia are also on the right subclavia. We notice here we've got 2 branches that come off very close to each other. Often this one here comes off prior to this one. Okay, so we have a little bit of an anomaly here. Sometimes they come off a common trunk. This one is always coming off more medial to this one. Okay, so this one here, it looks like it's going straight up the neck. Well, in fact it is. It's actually going through the transverse processes of cervical vertebra 1 through 6. And so this is the vertebral artery. Okay, this next one here is the costo-cervical trunk. It's going to give off the first few intercostals as well as the deep cervical, hence costo-cervical trunk. Okay, come a little further here. Don't worry about these little guys coming off, but coming off at about the same level, one coming cranially and one coming ventrally, we're going to have 2 vessels. This one here, as you see, stays within the thorax, and so that's going to be the internal thoracic artery. This one here is heading over towards our superficial cervical lymph nodes, and so let's refer to this as the superficial cervical artery. Yep. Okay. Now we noticed here that we have other vessels coming off the dorsal aspect of our aorta. So those are the rest of the intercostal arteries. Okay? At about the level of the 5th, we're going to see a vessel coming down here, and here's our esophagus. So the esophagus is running through right there, and coming across it, providing branches to it, and then providing branches into our bronchi is the bronchoesophageal artery. Okay? This artery is going to supply the lungs with nutritional blood. Okay, so this is oxygenated blood for the tissues of the lungs. Remember, the functional blood of the lungs is coming from the pulmonary veins. Okay, so now we're going to have a look at the right side of this animal. We look back in here and we can see the cranial vena cava here. Yeah, this great big vein here is an azygous vein. But now here we can see the right subclavian artery coming out. Okay, so it's going to have the same branching we saw on the left side, although this one, the vertebral, comes off before the costo-cervical, like I said before. Okay, it didn't so much on the other side, but it does here. So that's our vertebral, kind of down in here. And then this one here is our costal cervical, giving off our first few intercostals and our deep cervical. Actually, this is probably our deep cervical branch here has been torn. Okay. Then we come around here and we can see our internal thoracic artery staying inside the thorax, and opposite of that would be our superficial cervical artery. And then coming around that first rib is the axillary. Okay. We can also see here the right common carotid artery. Okay. Now when we cut the abdomen here, I had a very nice linea alba, okay, running down the midline. Remember, that's where the aponeuroses come together. You notice this very fatty portion here. This is what's known as the falciform ligament. Okay, so we cut this and reflected it out of our way. You probably noticed in some of the other specimens that this was overlying much of the viscera here. This is the greater omentum. Okay. The greater omentum has some very nice healing properties. So if there is a wound somewhere, it'll cover over that and then it'll help it heal. It'll also adhere to that, but it's a good healing structure. In fact, I've read articles where they've exteriorized this, put it into a wound in the limb, and helped heal the wound. It's not very practical, but it was done. Okay, this animal has puppies in the uterus. Okay, so we'll come back to that when we talk about the reproductive system. Okay, so we need to reflect that out of our way, and we need to reflect our descending colon, which runs down the left side. We need to reflect that, and we actually had to cut some of our mesocolon to better expose the aorta. Okay, so the aorta, as it comes down into the abdomen, it's going to have three main unpaired branches. Okay, the first of these is the celiac. The celiac artery is going to supply the spleen, the liver, the stomach, and much of the pancreas, mostly the left lobe, but also a good portion of the right lobe, as well as the cranial part of the duodenum. And then just caudal to it here, coming off at an angle, is going to be the cranial mesenteric artery. This is going to supply most of the rest of our digestive tract, so it's going to pick up at the distal part or the caudal part of the descending duodenum and pancreas, and it will continue all the way up, supplying up past the left colic flexure to the initial part of our descending colon. Okay, so we'll talk more about that with the digestive tract. So then as we come caudally, so if we look here, we can see very nicely the outline of another one of our endocrine glands. This is the adrenal gland because it is adjacent to the renal structures. Okay, you'll notice this vein that crosses it, a very good landmark for finding it. And if we were to cut it open, we're going to see that it has a very distinct cortex and medulla. I don't know that you can appreciate that, but it is very distinct. And we're going to find that both the cortex and the medulla have totally different functions. Okay? So we reflected the kidney. We can see this animal has two renal arteries going to it, or actually a common trunk that branches early. That's not uncommon. So that's the renal artery. As we come down here, we then have two that come off, usually not right opposite each other, but very close. And in this animal, we can see that this artery comes up, and if we follow it on up, we're going to see here in the mesovarium a very tortuous vessel coming up to the ovary. So that is the ovarian artery. Okay, the testicular artery is going to be coming off at this very same level. Okay, so look for that. They're very small. Testicular artery is going to course caudally and go through the inguinal canal. So we'll talk more about that with reproductive. Okay, Then we have our last of our unpaired arteries here, coming to the descending colon. That's going to be our caudal mesenteric artery, and it's going to supply that, and it's also going to supply the cranial aspect of the rectum. Okay. Now, either side of that here, we're going to have a vessel that runs over here to the flank. That's going to be the deep circumflex iliac artery. Okay. Now we continue caudally, and we can see that the aorta branches. These are going to be the external iliac arteries. These give rise to the femoral arteries in the limb. And then we have, caudal to that, the internal iliac arteries, which are going to supply the structures of the pelvis. Okay?